Hello, my name is Dr. Mate Shiluli, and today we'll be discussing sickle cell disease. We are doing partnership with Ponea Health, so welcome to this discussion today. So sickle cell disease is an inherited disorder that affects red blood cells, so we have abnormal red blood cells. So sickle cell, we have two cases. We have sickle cell disease and sickle cell trait. For sickle cell disease, there are those patients who develop the disease when they inherited the trait from both the parents. So the fathers are trait, the mothers are trait, or one of them has the disease. But for the trait, we have those people who have inherited the abnormality from one parent. So they are the carriers of the disease, but they don't manifest the symptoms of the disease. So this disease is shown that is more common in sub-Saharan Africa. And if you come back to our country, it's more common in the Western and the Nyanza region. It's very interesting because you have a relationship between malaria, and these two regions are the malaria endemic zones. So for patients who have sickle cell trait, they're protected against malaria. But those who have the disease, they have severe forms of sickle cell disease. Sickle cell crisis is actually just a painful crisis because of blockage of blood vessels due to occlusion when the red blood cells get clogged together. So we have several factors that can exacerbate the sickle cell crisis, and these are very important for you to know. One is dehydration. So we encourage this patient to take a lot of fluids frequently. And then there's hypoxemia, where we have low oxygen saturation. Those patients, people who have high altitude areas or deep sea divers, we also want them not to be in such environment. Or those people who live in enclosed environments, they have a risk of getting the crisis. And then any infection, simple pneumonias, simple urinary tract infections, gastroenteritis, they are predisposing you to get the crisis. And then we have patients who have acidosis. This mainly you will find it when you visit a hospital. You might not pick it at home. And then any stress, psychological or any cause of stress, will be a predisposing factor. And then any surgical procedure can also predispose you to getting this, because surgery itself is a stress. And then you also have other medical conditions like myocardial infarction. There'll be a risk factor to getting the crisis. So crisis could be prevented if we know about these predisposing factors. We need, the way you can alter our lifestyle so that people with sickle cell disease can live a normal life is to, for those who have the disease, we need to educate them on the risk factor that can make them to go into a crisis, which you've mentioned, dehydration, infections, you've mentioned hypoxemia, you've mentioned acidosis, you've mentioned any source of stress. So you need to handle any source of stress for them so that they live a good, normal life, a good life. Thank you so much for joining me in this episode and discussion. You can book my services through ponea.com.